I had a patient, she was like 13 years old, and she had rhabdomyosarcoma, so half of her face was missing. She never saw her face, so every time when she was coming to my clinic, we were all covering the mirrors for her not to see her face because she didn't know what to expect. So when I fabricated her facial prosthesis, it was her first time that she was going to see her face. And I held her hand, she held mine as well. That moment when she saw herself in the mirror was like so meaningful, so emotional. Seeing her face smiling was the biggest gift I think that a maxillofacial prosthodontist can get.
Probably the most difficult ones are orbital prostheses, and that involves the skin and the eye. So you have to make an artificial eye to match the eye, and you have to match the eyelids. So there's multi-level aspects to the prosthesis.
I discussed the treatments of these patients with a huge team involving plastic surgeons, ENT doctors, radiologists, oncologists, physical therapists, swallowing and speech therapists. It's possible for me to discuss every case in detail to save their lives.
These patients, a lot of them, because of the defect, they're a prisoner of their own home because they only leave to go to the doctor's appointment. One thing about our work is we don't want it to be seen. That's the irony of it, is if you don't notice it, that's great, then we succeed.
With these prostheses, it's possible for these patients to go back to their normal lives and regain their quality of life.
In an age today where everyone wants to stand out, these people don't want to stand out. They want to blend in with everyone else so that you can walk by them and they don't recognize that you have a nose missing or ear missing.
The treatment, the help that you can provide to these patients is the real motivation that put me into this profession, and I'm really very happy that I'm working with these patients with these maxillofacial defects.
There is only 200 actively practicing maxillofacial prosthodontics in the entire country. So if we talk about the University of Pittsburgh area, here we have 4 actively practicing maxillofacial prosthodontics who cater to the needs of the population of Pennsylvania, West Virginia, and other nearby states as well. If we try to align these numbers to the head and neck cancer cases with increasing numbers every year, it just doesn't match up.
We have to create an awareness. With prosthesis, it's possible to give these patients their smile, their confidence, their functions, and quality of life back.
It's very challenging, so it's satisfying. You know, you can meet that challenge and at the same time give a patient a new life and new hope.
So these prostheses really easily and quickly can help these patients to function properly. And I am so proud to be a part of this wonderful team that I am working with to treat these patients.